All right, hello. My name is David Garner. In this presentation, we're going to be talking about the use of vibration as a modality in therapy. And so let's get started. Who am I? So I'm an occupational therapist, and I've been practicing for about 5.5 years now. I graduated with my master's in OT from Tennessee State University in Nashville. I hold a certification in physical agent modalities, and I also hold a certification in chaplaincy. So today we're going to focus on the use of vibration, which may be something that you have never heard of being used as a tool in therapy practice, whether PT, OT, speech therapy. Oddly, vibration was not taught as a modality in my master's program. It wasn't even mentioned in any of my textbooks. It was briefly mentioned in my PEDS class as a useful tool for sensory-seeking kids, yet vibration has numerous benefits for a wide variety of ailments across the lifespan. In fact, experienced therapists have told me it used to be quite popular 30, 35 plus years ago as a tool in the therapy gym. Vibration has been used in medicine for well over 100 years. Why did it go missing? I'm not really sure, but I'm here to hopefully convince you to add this fantastic modality to your bag of tricks. In this presentation, I'll primarily be discussing the treating of the adult population, as that's where all my experience lies. But it does have uses in the pediatric and children populations as well. I first learned about vibration for sore muscles as a personal trainer prior to becoming a therapist, and I used it a few times early on in my OT career to help address muscle cramping. But I began to learn much more about it just a couple years ago when I did a short-term travel contract for a company that prohibited all other modalities from the therapy gym, including heat and ice. And they had their reasons, but they didn't have any policy surrounding vibration. And so because they took most of my other tools away that I used quite frequently, I felt, I began searching the literature to find what sort of research there was about vibration and if it had any benefits that it could be used to replace any of my other modalities. And I was shocked to learn that it offers way more than I ever anticipated. So what are the benefits of vibration as a modality? Let's jump in. So the first thing I think, and perhaps one of the best benefits, is that it's extremely cheap. Vibrating massagers can be found all over the place for as cheap as like 30 bucks. And if you're willing to go on Amazon and get the quote unquote used ones that are usually just returned open box, they can be even cheaper than that. So So the next thing that I'll point out is that vibration has a pretty small learning curve. It's not really that complex, and so it can quickly be learned by new therapists, experienced therapists, and we'll talk more about that. There are very few side effects. We will talk about ones that can be present, but there's not many to keep in mind. It doesn't often require long treatment times, which can be nice in a hurried therapy environment. And you don't need any certification to implement it. As I said, I used it as a personal trainer. That wasn't necessarily something I learned about when I became certified as a personal trainer. So there's no real legal restrictions around it, to my knowledge, in most situations. There are a few drawbacks. The results of using vibration as a modality can vary. There's not a whole lot of research behind it, sadly, even though it has been used in medicine for quite a long time. There is some research, which we will talk about briefly, but just the amount that's there leaves a lot to be desired. And there are potentially side effects, though, like I said, they're very minor in most cases. All right. I do want to address terminology just briefly. So a lot of people you'll find just tend to refer to these massagers as vibrators. I prefer to avoid the term vibrator because it's also used to commonly talk about sex toys. So when I'm in the gym talking about using a massager with a client, I don't want other people to overhear our conversation and think we're having a private conversation in a public area. So I like to use the term vibrating massager or simply massager. I think they're good substitutes, and you might quickly find out why I prefer these terms. I'll share one story. I had an elderly female patient who was having a lot of pain in her arm after a stroke. She had some real tight spastic muscles, so we were using it to relax her muscles a little bit. And after our session, we go back to her room, and this is at a skilled nursing facility, so she had a room, and her daughter was there in the room. And as soon as we get back in the room, she walks in, goes up to her daughter and goes, "This therapist used a vibrator on me and it was great." And I just stood there trying to pick my jaw up off the floor, and her daughter goes, "Yeah, where did he use it on you?" And she goes, "On my arm," thankfully. And so I quickly stepped in and explained that it was a back massager, vibrating back massager, not some sex toy. And I explained that we used it to relax the muscles, not for anything private. So those are the kind of situations that I try to avoid with my terminology. A couple other terms to point out: vibrations per minute and revolutions per minute are both terms you will see. They're kind of used interchangeably, but they refer to the frequency of the vibration. So if you've ever used a massager, then you may have noticed that it has different settings, sometimes 3, 4, 5 different settings, different speeds that it will vibrate at. And so these terms are what they use to indicate the speed or of the frequency, really. Other manufacturers will use the term hertz, which is a measure of oscillations per second rather than per minute. So it'll be usually abbreviated HZ, hertz, and revolutions per minute are the ones you see most. VPM you also see sometimes. Usually on one product, they'll only use one of these terms, not both of them. But we'll talk more about that and what the frequencies mean and what the use cases are for them. All right, next slide. So let's dig more into these benefits a little bit. So when I say vibrating massagers are cheap, what I mean is most units are under $100. Some under 50, some under 30. So they can be very inexpensive. They can be a little bit more pricey, but compared to other modality machines, that's pennies compared to many of them at least. Especially the more modern fancy ones that you see on the market nowadays. Low learning curve. So massager use is something that's pretty easy. I mean, I think it's easy enough in most use cases that patients and caregivers can be taught how to apply it in 10, 15 minutes, 20 minutes maybe. You can teach a caregiver to apply it in one therapy session, oftentimes. Sometimes follow-up may be helpful, but yeah, it's pretty quick to teach if you choose to do that. And so that means it's pretty easy for therapists to learn and implement as well. There are not very many side effects. Sometimes patients can experience an increase in pain rather than a decrease. We'll talk more about other side effects, but usually the increase in pain only lasts while the massager is directly in contact with them. Say they have a lot of muscle knots or muscle cramping. The vibration, especially at higher frequencies, can actually cause the muscles to tense up even more, so that may increase some pain. But usually it stops more or less as soon as the massager is removed from contact with them. It's hard to overdo vibration. So, you know, with heat modalities especially, and some with E-stim, you can definitely overdo it, especially with the heat ones. Vibration, there's not really an upper limit to how long a person can use it for. I suppose, you know, if you're out over there using it for an hour, you may have some tingling after or something, but it's pretty hard to overdo it with vibration. Typically, at least in my clinical experience, it doesn't take a long amount of time to create the effect you're looking for. Usually 10 to 20 minutes is enough. Oftentimes on the low end of that, 10 minutes is enough to have the desired effect. And again, there's no certification needed, although hopefully this course will help you understand how you can use vibration a little bit better. Let's talk about some of the drawbacks in more detail. So the results do vary. It may not be as consistent results as other modalities like E-stim or heat. So vibration does not seem to be effective for all patients, at least with some of the treatment goals. Reducing pain, it usually is pretty much always effective, but the other effects that we try to produce with it, the results can certainly vary. There is not a whole lot of research. I have included some, which is the vast majority of what I've been able to find, which is only a handful of articles and studies. So there's more out there probably that I haven't found yet, but the research that I've included is promising, but we definitely need more to broaden the body of research behind vibration and to improve our understanding of how to use it to create the desired effects as far as treatment times and frequency and things like that. There are a few side effects that are possible, and we'll talk about that in the next slide. So some of the side effects that you want to watch out for inform the precautions. So there is a risk that you can cause blood clots to dislodge. So that's one of the number one things to keep in mind. So if a patient is at risk of, or there is presence of blood clots that are known, that's probably a time where you would not use vibration unless they've been on blood thinners for a while and you're pretty sure that, you know, the blood clots have mostly cleared up or whatever. So this is a case where you may communicate with the doctor about whether or not they believe that it would be appropriate to use vibration. Sometimes if a patient has maybe like a blood clot in their leg and they've been on blood thinners for a while, or they have a stent in place, it may be okay to use the vibrating massager on their arm, right? Well away from that limb that has the known blood clot. But it's definitely something to keep in mind because there is a risk that they throw that clot and have very major ramifications. Vibration is definitely not indicated directly over top of wounds or tumors. Also avoid using it on a limb or areas with unexplained swelling, or swelling related to an infection. So vibration can sometimes be used at low frequencies for chronic edema, lymphedema, but that is a more specialized use of it. And if you do not know the cause of the swelling in an area, I would definitely avoid using vibration there. Definitely want to avoid it over top, like directly over top of implanted electrical devices. On other parts of the body away from that, it's okay. It's not going to interfere, but you don't want to have the vibrating head directly over top of any implanted electrical devices. Next to fractures that don't have reinforcing hardware. So if they do have hardware, you know, that has stabilized the fracture, and there are actually vibrating devices now that are purposely designed to improve bone healing, that are worn over top of the fracture site. But for fractures that are not reinforced, it's probably best to avoid using vibration real close to that fracture site. Some patients are sensitive to vibration, so that's definitely something to keep in mind, especially if your patients have low mentation or communication abilities. And I'll refer you to your device's manual for further warnings and precautions, because different devices and manufacturers do discuss other concerns. Okay, let's talk about some adverse reactions that patients can experience. So notice that good sensation and mentation were not mentioned in the precautions, really. I did briefly touch on it, but essentially, because there's such a low risk with vibration, again, there's not a lot of research around it, but it's pretty safe to use with patients who do have low mentation and communication skills. and patients who have decreased sensation as well. So again, you still want to watch for reactions such as pulling away. But in general, it's safe enough as long as you have considered those prior precautions, that you're not there's very low risk of negative effects. It's really quite extremely safe in the vast majority of situations. Again, keeping in mind those prior precautions. Adverse reactions that can happen include some swelling. There can be minor swelling, usually it's not major. Localized reactions, like allergic reactions, vibratory urticaria is a real diagnosis and is evidenced by redness, itching, and swelling at the local site. But fewer than 1,000 people have this diagnosis in the United States out of, over 330 million. So it is an extremely rare condition. But again, you have to test with your patient. Again, if you have or a patient who experiences this, is very unlikely to be any long-term lasting implications. They may benefit from some sort of antihistamine, but don't use vibration again on that patient. But it's very rare that they're going to experience that level of reaction. General itching, though, just like a slight pins and needles sensation or very mild itching, is actually pretty common symptom after use of vibration. As long as the patient can tolerate it, this isn't really something that will prevent the use of vibration in the future. However, if they have that pain and swelling associated with the itching, then that would probably indicate a negative allergic reaction that would, in my mind, prevent me from using it again in the future. But general itching, I experience mild itching. Quite a few of my patients do. It's usually gone in 15 to 20 minutes after use. And, when you're distracted with another task, you usually forget about it pretty quickly. So those are the real adverse reactions that you're likely to see, as long as you're keeping in mind the prior precautions. So using vibration at your facility, what are the rules surrounding it? Well, I would encourage you to check your state practice act for regulations regarding the use of vibration in practice. To my knowledge, no states have any regulations around the use of vibration by therapists. I could be wrong about that. I have not read through all of the 50 practice acts in the United States, but to my knowledge, none of them really regulate it. But check yours. And also check your facilities policies where you work. Because one hospital I work at does require doctor's orders, even though we come out of school being licensed to use modalities. One facility I work at still requires us to have a doctor's orders to use certain modalities. And so, check your facilities policies. Our policy at this facility I work at does not cover vibration. They mostly cover just E-stim is the only one, I believe. But look at your facility and state's policies. And I would also encourage you, if you're thinking about using vibration with a patient, there's two things that you could consider doing. One, ask the patient if they have ever used a back massager or any type of vibrating massager before. because if they have, that experience would tell you that whether or not they had any negative reactions. And two, bring it up to the treatment team and especially the doctor, and keep in mind those prior precautions. So it can be something that you run by the treatment team before you implement, if you have concerns. All right. So what is vibration good for? Pain, we did mention, especially related to muscle cramps and muscle soreness. Also neuropathy pain and sciatica pain. Any type of pain, just about. We'll talk about that in a little bit more detail shortly. Hypertonia, it's useful for decreasing the muscle tension and the pain related to that. And it's useful for relaxing muscles in preparation for stretching. It can be useful for unilateral neglect. It can be helpful for hypotonia, especially post-stroke, tremors, and several other things. Frequency ranges. So there's two major ranges of frequency that we want to keep in mind. Muscle relaxation happens between about 20 and 60 hertz, or 1200 and 3600 RPM. Higher ranges can induce some muscle relaxation as well, but the higher ranges, because they can induce muscle contraction, the lower ranges can be more comfortable if your goal is to relax the muscles. Muscle contraction is stimulated best by 90 to 130 hertz, roughly, or about 5400 to 7800 RPM or higher. So basically, if you think about the hertz scale, between 1 and 130, so anything 60 and below is going to tend to cause relaxation of the muscles. Anything 75, 80, 90 and above is going to tend towards causing muscle contraction. And if you have a massager, you can test this out for yourself with the various settings on your own muscles. All right, let's talk about addressing pain. So I've used vibration with many patients in an inpatient rehab setting where they experience a lot of post-surgical muscle cramps. So I had a patient who had a hip replacement, and as I recall, she was taking the maximum dose of pain medicine that the doctor would allow her. This is like within the first couple days of her admitting to our facility, and we're trying to do our evaluation, and she's not wanting to participate or move because she's having 9 out of 10 pain constantly. It doesn't fluctuate throughout the day. She's refusing therapy, everybody, not just OT, and she was not permitted to take muscle relaxers because of whatever the medical reason was. So on the medication side, her options were maxed out. She had no other real medication options left. She was refusing therapy, and was at risk of being cut because from the facility, because she was there for therapy, and they have the 3-hour rule. And so the second day that I tried to see her, this is early on in my career, so I didn't know much about the use of vibration at that point or the research behind it. So I decided to try a massager, which I had found effective as a personal trainer. So we happened to have one at the facility, and we used it around her hip surgical site, all around, even up into the low back, and the thigh area for about 10 minutes. And her pain dropped from a 9 out of 10 to a 4 out of 10 after just 10 minutes. No change in medications at all. And she was then more than willing to do therapy. She almost hopped up out of the bed, and we did my evaluation, and she was willing to participate in physical therapy later after that as well, because her pain was so much better. So that was one of the first experiences that really showed me the power of vibration as a modality. And so we started, because her pain came back the next day, pretty high, 8, 9 out of 10. We started bringing her to the gym like 15 minutes before her sessions and just letting her use the massager on herself. That way it wasn't taking time away from our schedule. And she was so much more willing. She had relief from her pain, and she was able to manage participating in therapy. And so it was a game changer for her. So addressing pain, I think, is by far the number one thing that I use vibration for in the gym, in therapy. It can also be useful for pain related to sciatica, chronic back pain, arthritis pain, and others. So when you use it, the best that I've found is to apply it on the lower settings in those lower frequency ranges that lead to muscle relaxation we just talked about. And of course, never directly over a wound or an incision. You also want to avoid bony areas, because that vibration directly in contact with the bone isn't real comfortable. So you're going to focus on healthy, soft tissue areas only. Implementing it in practice, apply to the affected region, focusing on the soft tissue areas. And if possible, teach the patient or a caregiver or even a rehab tech, CNA, to apply it. And you can typically you can see an improvement in a patient's willingness to participate in therapy when their pain is lower. So as with that patient I mentioned, a large percentage of my patients who I use vibration with, who have that real high pain, 8, 9, 10 out of 10 pain, more often than not, 10 to 15 minutes will cut their pain almost in half. Sometimes it'll drop it at least 3 points, sometimes as much as 5 or 6 points on the 10-point pain scale. So it's a real game changer for a lot of patients. Let's move on to addressing hypertonia. So it can have similar effects to electrical stimulation, though E-stim usually has a little bit faster results. Of course, not all patients are good candidates for electrical stimulation, so that's where vibration can come in as a substitute. So I've used vibration with a few patients who've had contractures, such as at the elbow or the neck with torticollis, and I've been able to make small improvements in range of motion over several treatments, maybe as much as 15, 20 degrees. Most of them gained enough range of motion to apply a splint or a brace. I've used it mostly with patients who had like almost a complete contracture, like at the elbow, or a real severe torticollis, and just had a lot of pain with that. And we weren't even able to get a brace in there because the contracture was so severe. And so, or the spasticity was so severe. So it's really a problem when they have the contracture with the spasticity. And so that's the application where vibration can be extra helpful. A few of my patients, we were not able to see any improvement in range of motion, but the vibration at least relaxed some of the hypertonia and spasticity and allowed for at least some temporary pain relief. Vibration is definitely cheaper for use at home. So patients who were not in long-term care, but were going home and had some sort of hypertonia, I have found it useful to educate caregivers on how to use it to help manage that pain. So when you're using it, you want to apply it in the relax range to the agonist muscles, or in the contract range to the antagonist muscles, which can sometimes stimulate reciprocal inhibition. So you can actually attack both sides of the affected joint. And longer treatment times tend to be better. 30+ minutes seem to be ideal, at least in my clinical experience. But some research has shown that just applying vibration is about as effective as just applying stretching. So what I do is combine the two, and there seems to be a synergistic effect. So if you can apply the vibration while applying a gentle stretch of 5 to 10 minutes, long stretch, that's where I've found the most effectiveness. So implementing in practice, this is primarily for patients who cannot use e-stim, such as maybe they have a pacemaker present. Easy to teach to apply at home for long-term patients, and use proper device for the specific location that you're targeting. We'll talk about this again a little bit later. All right, so hypotonia. This is another area that I've used vibration quite a lot. Hypotonia and pain are probably the two primary treatment areas that I use it for. It's real helpful for hemiparesis following a stroke, especially with patients who, again, have some sort of implanted device and can't do e-stim. It's also easy for patients to apply on themselves or family members to apply at home. I know that there are other modalities patients can get post-stroke to aid their recovery, but they're often quite expensive. There can be a large learning curve. Vibration has neither of those drawbacks. So again, e-stim is probably more effective, but vibration can be a decent substitute. I've used it on just about all parts of the body that are typically affected. So let's get into the slide here. Vibration should be applied to the muscle belly to excite the muscle tissue and stimulate contraction. The effects include promoting neurogenesis and also strengthening the muscles. And again, similar to e-stim. E-stim encourages muscle activation during application, even if there's no visible activation happening, and it engages the CNS to an extent, but really we want to encourage the patient to activate the muscles, attempt to activate the muscles when we apply the vibration. So it may take a few sessions to really see results, especially if their limb is completely flaccid. So we want to apply the vibration to the muscle belly at the same time that we're asking the patient to try and contract that muscle. So when we implement it in practice, we're going to apply it for 10 to 20 seconds directly onto that muscle that we're targeting, and we're going to ask the patient to contract for that amount of time and then rest for a few seconds. And then you can move to the antagonist muscle if you want. So we're actually following a typical electrical stimulation pattern there by activating one side and then letting that side rest and immediately going and activating the opposite side and back and forth for the entire treatment time, 10, 15 minutes. 5 minutes may even be enough, especially if you're trying to do multiple muscle groups on the arm, say. You may do 5 minutes on the wrist flexors and extensors, and then move up the arm and do 5 minutes at the elbow flexors and extensors, and maybe even move into the shoulder area, what have you, or down into the palm to do those small muscles in the hand. All right, so let's talk about which devices you're using where. So your typical back massager with a single head, and we'll talk about design of massagers more later, but just briefly here, your typical back massager is fine for the large muscles of the leg and of the arm. But with facial paralysis, I find those can be too big, the head too big, the vibration maybe too intense. So I found a sonic toothbrush to be a good substitute. All right, next slide. Unilateral neglect and/or low arousal. So vibrations in the low frequency range can provide an excellent stimulating or alerting effect. So high sensory of many types applied to the hands, arms, the chin can increase alertness and attention to those specific body regions. So for unilateral neglect, you can apply to the affected limb or a limb on the affected side at least. For low arousal, I'll also maybe apply to the hand or even to the face or the chin, preferably with like a sonic toothbrush if you're gonna get on the chin. So those areas I've found to be most effective. There's not a whole lot of research around this topic. I think I've only seen one study for unilateral neglect, but I have tried it with a few patients and seems to have pretty good results. I remember one patient actually earlier this year who was typically or had been at our facility for about a week on another therapist caseload. And one day I saw them because that therapist was off. So I picked up the patient on my caseload. And for the whole week they had been in therapy, they had not looked past midline. Well, I decided to try a little vibration. So we did it on the shoulder area and the arm for about 5 minutes at the start of my session. And not 2 or 3 minutes probably after we ended, the patient turned and looked to the affected side for the first time. And it was a really cool and emotional moment because their family members were actually there to see it. So that was really exciting. This patient's family had been there every single day just about. And so it was really cool for them to get to see that as well. And that patient went on over the next week or two to attend a little bit more and more to the affected side. Of course, it wasn't a miracle, but we did see a slight improvement every few days of attending to the left side. So I would encourage you to experiment for yourself with vibration for this issue and see what your clinical experience produces. So when we implement this, there's a few things to keep in mind. So because of the decreased mentation that often goes along with this, the decreased sensation sometimes, I like to start real light with the application of vibration. So I will introduce it for maybe 2 to 3 seconds only, maybe on the lowest setting, and just see how the patient reacts. And then slowly increase the contact time 10, 15 seconds, then 45 or a minute, something like that, just so I'm not overwhelming the patient or causing stress. And so you can apply in the study that I saw, it mentioned 5 minutes. And that's what I usually do at the start of my session for patients with either of these issues. Just apply it for 5, 6 minutes and then move on with whatever other treatment things I have planned. So it doesn't really take away from your other treatments. All right, addressing tremors. So this is one that really surprised me. I never would have guessed, and I only came across the use of vibration for this issue because of a video on YouTube I saw where a company is actually researching creating wrist-worn devices for Parkinson's tremors. So I looked into some research, and there's actually some decent research behind the benefits of vibration for tremors caused by anything, really, not just Parkinsonian tremors. There is limited research, but compared to some of the other topics I'm discussing here, there is more on this one. So the limited research that does exist shows good results. And so what I've found to be helpful is to use, you can use a back massager, but because we're targeting the hand, it can be more useful to just use a vibrating ball. So you can find those on Amazon. They're like for massage. And you can use it on the affected hand or extremity for 10 minutes, 2 to 3 times per day, such as right before a meal, because the best results are found immediately after the application. So maybe do it for 10 minutes before a patient sits down for a meal to really see the best benefit. One caveat is that the results may take a long time to see, 2 or even 3 weeks of treatment before the patient really sees significant results in improvement of their tremors. So that's definitely something to keep in mind, and we definitely need more research around this topic. And the other drawback is that the benefits only last as long as the patient continues to use the treatment. So if they do the vibration for 2 or 3 weeks and they see really good improvement and then stop, their tremors are going to return pretty quickly. It's not something that causes healing or eliminates the tremors. It just minimizes the magnitude. And so I'll share one patient experience I had with a bedridden patient who was in a long-term care facility, and his tremors were extremely severe. And this is a good case study. I wish I had the time and resources to actually write up a paper on this, because I worked with his doctor and his neurologist, and during the time of my application of vibration with him, there was no change in his medications. And we also know that none of the medications he was on were causing the side effect or causing a side effect of tremors. So we know that the results came from the application of vibration, not from some medication change. And so his tremors were some of the worst I've ever seen in my entire experience as an OT. His tremors were sometimes as bad as 10 centimeters of amplitude, and they just prevented him from doing almost anything. I mean, he was very motivated to feed himself during meal times because that was one of the only things that he could still do for himself, that and facial grooming. And so he would work on it. He didn't want the staff to feed him, and so he would spend 2, sometimes 3 hours working on feeding himself because he used regular silverware. He didn't really like the adaptive silverware. We tried weighted. It didn't really have much benefit because his tremors were so terrible. And so it was just a huge struggle because almost every time he picked something up on a utensil, the tremors would knock it right back off. And so it took hours for him to eat any meal. But he was very determined. So we started vibration in the hands, 10 minutes twice a day in each hand. And after 2.5 weeks, his tremors improved to just 1 centimeter of amplitude, which was life-changing for him. And his eating time went down from sometimes almost over 3 hours down to just 1 hour. In both hands, he saw improvements. And so he was extremely grateful. And I was very impressed with how effective this treatment was, and also his dedication to applying it twice a day, right before meals. He had the cognition to do it himself, so it didn't require the time of any of the other staff. So I've gone on to teach quite a few other patients or educate patients about the benefits of this, and they go and immediately buy a ball for home use. And so there is really good benefits for a lot of patients, maybe not all patients. I should caveat that, but a lot of patients do see good results with this. So in the long-term care setting, so if you're implementing this in practice, it's something that the therapist can try for a few weeks to see what the benefits are. And if the benefits are seen, then it can be transferred to a restorative program or to a caregiver if the patient is in a home setting. All right, next slide. Neuropathy. So vibration has 2 benefits with neuropathy because there are often 2 different symptoms from neuropathy. Numbness on the one hand and pain on the other. So vibration provides increased circulation, reduced pain, and high stimulation to the nervous system, promoting regeneration. So if a patient has a fairly new diagnosis of neuropathy, they may actually see some improvement, long-term, long-lasting improvement, or possibly even elimination of their symptoms of neuropathy. For patients who have had neuropathy for a long time and have the severe nerve damage, they may not have a complete elimination of their symptoms, but they may experience some relief at least. Localized application helps to reduce the pain and the numbness, at least in most patients. So to implement in practice, it's most useful for the lower extremities. And I find it's easiest to apply with a vibrating foot plate massager instead of a handheld back massager design. So you may have seen those foot massagers that you can buy and set your feet on top of. They make ones that vibrate. And so that's what I have found to be useful for neuropathy. They can do it while seated. They can wear their shoes or not, depending on their preference. And all that they need to do is apply for 10 to 15 minutes. And it has similar pain reduction benefits as we mentioned before, from 4 to 5, even 6 points on the pain scale. And the benefits usually last for several hours. So they can do it in the morning and they may have benefits throughout most of the day. Or if there's a certain time of day, like maybe nighttime is when their worst symptoms are, they can do it right before they go to bed. And really experience benefits pretty quickly. This is not one that requires a lot of treatments before they notice benefits. Usually the first time they try it, they see some benefit. I had one patient in a long-term care setting whose neuropathy was so bad, despite the max amount of pain medication, gabapentin, all the things, he had neuropathy for years. He had not walked in over a year because his pain had gotten so bad. It was constantly like 8 or 9 out of 10 almost every day. And so, but he was very motivated to be able to take a few steps so that he could transfer to the toilet and not have to use the Hoyer lift. So we just decided to try the foot massager, and he had some of the best benefits that I have seen of any of my patients. His pain dropped about 5 points on the pain scale pretty much every treatment session. And he would even go and use it on the weekends. He'd get a CNA to push him over there and use it on the weekends without the therapist present. And after 2 or 3 weeks, he was standing longer and longer in physical therapy. And after a few weeks of being able to stand again in therapy, he was able to walk several steps. I think the farthest he walked was 10 steps, and that was a huge milestone for him after not having walked for over a year. So there really can be huge benefits for patients who have neuropathy. The numbness is probably not going to go away completely for most patients. A few of my patients have reported a slight improvement in their ability to feel the floor when they're walking. But the biggest benefit, I think, is managing the pain. All right. Freezing of movement. So this is another area where there's hardly any research at all. But I've tried it with only 2 patients, I think, and I have seen some positive benefits. So difficulty initiating movement patterns are common with Parkinson's and a few other conditions. It mostly affects gait. It can affect the upper extremities. So vibration stimulation can reduce freezing symptoms in some patients, at least partially. Applying it to the affected limb, and in my case as an OT, mostly to the hands, for 10 to 20 minutes, at least 2 or 3 times a day, is where I've seen the most benefit. So again, as with the tremors, you can apply the treatment immediately before activity like a meal or extensive grooming to really gain the best benefits. And yeah, this is one that you probably just have to try and see because there's very little research. I think I've found maybe 1 study looking at this. And in my experience, I used it with a patient and we did a finger tapping test to see whether there was any improvement in freezing. I have not used it to see about treating patients who have freezing of gait. That would be something that the PTs out there might try. But I can imagine that there may be some benefit because there has been benefit with the hand treatments I've done. All right. Insomnia and sleep hygiene. So vibration applied in the relax range definitely can improve overall body relaxation, not just to the muscles that are treated. So this can be beneficial for improving a patient's sleep quality and reducing insomnia in some patients. The massage induces relaxation and therefore reduces stress to some extent and anxiety. And it stimulates the parasympathetic nervous system. That's how it does that. So if you're going to implement this in practice, one area that's recommended is treating the feet, actually, in the reading that I have done, and also applying the treatment as close to bedtime as possible. Of course, you can do it in the back if there's muscle tension somewhere, the back, upper back, low back. I have never used this, never used vibration for this purpose with a patient. I have used it on myself a couple times when I was having a bit of trouble sleeping. I've never had a diagnosis of insomnia, so I don't know how well it treats that severe of a sleep disorder. But again, this is something that you may just educate a patient about, and they can try it on their own time, and maybe they'll receive some benefit from it. This is probably not something that a therapist is going to spend their billable time really doing in practice, aside from educating. Scar tissue mitigation. All right, so this one is a little bit different. So up until this point, all of the issues that we have discussed, we're going to use a vibrating back massager or some sort of vibrating massager. For scar tissue, we're going to, instead of using a vibrating one, we're going to use a percussion style massager, commonly called a massage gun. These are super popular in the world of athletics and weightlifting. And so what we're looking for is that back and forth movement that is going to mimic a massage technique. So what it will do is break down scar tissue, increase blood flow to the area, can alleviate some pain, it can reduce itching for some patients, and it will help to minimize scar tissue formation. And the thing that I like about this is that some patients I've had, I teach scar massage technique to, but they don't use it because for whatever reason, I guess they feel like it's a lot of work or they're busy, what have you. A patient may be more likely to use a massage gun over their scar. Perhaps they feel like it is quicker, it's easier than self-massage technique, which can be tiring to your hands. So, of course, using a percussion massager, massage gun, is probably contraindicated for scars over bony prominences or areas of real thin tissue. But it can have similar benefits to typical manual massage technique. So educate your patient on how to apply the massage gun to their closed, healed scar, granulated scar. And they can use for 10 to 20 minutes a day as tolerated. And I would probably encourage them to use it similar to manual scar massage technique where they're going in multiple directions so that they're moving that tissue around as appropriate. Hyperesthesia. So hypersensitivity, this is another topic that I have not really addressed with a patient yet. Maybe once I educated them about it. I didn't actually use it. This is one that I don't think that I've actually really used with a patient yet. I think I educated one patient about it so that they could do it at home, but I didn't actually apply it in treatment. So this is another one where we're going to be real careful in how we initially apply the vibration. We're going to start on the lowest frequency setting, and we're just going to gently apply for 1 to 2 seconds on the first attempt to see how they respond. And then increase as the client tolerates up to 4 to 5 minutes per day. So this is not one that really requires much time. Some patients are going to be so sensitive that they really struggle to tolerate even the lowest frequency. So you can place a sponge or maybe a folded up cloth in between, and then they may be able to tolerate it some and gain some benefit. Also, you could try a sonic toothbrush instead of a larger back massager. And the classic technique is to use a tuning fork. So that may also be less intense for the patient. So if you have one in your gym or the patient decides to buy one, that is also an option. And of course, this should not be the only treatment. It should be applied in addition to other desensitization techniques and exercises. All right, instructions for use. So when you're going to use vibration as a modality, begin by reviewing the precautions and then select the appropriate frequency ranges or range for your targeted issue. Of course, start by explaining the purpose of what you're about to do to the patient, and then test momentarily on a patient's hand or foot. So I like to test the vibration or expose them a little bit on the unaffected limb if possible, just so that they have an idea of what to expect when I apply it for longer. And then you're going to apply your treatment, and then you're going to document, and finally educate on use at home as appropriate. So when we document vibration, I do it just like I would any other modality. So record the purpose of the treatment, the site treated, duration of treatment, the vibration frequency, if possible, as in if you know what the frequency was at the setting you used, and the results of the treatment. It can be billed as other modalities would be. I usually bill it under therapeutic activity or neuromuscular reeducation. And if I'm not sure of the frequency that was used, because occasionally some models do not list the frequency that their device produces. So you may use the particular setting of your device, describe that in the documentation, not only for insurance, but also in case other therapists come behind you and need to also use that modality. But most devices that I have seen, the frequencies are listed in the user manual for each setting. All right. Selecting the appropriate tool. So let's talk about the different options that you can find. There are two types, as we briefly mentioned before, vibrating and percussive. So the percussive massagers, a massage gun, they're quite popular nowadays. And the percussive action, the problem is that it can be too harsh for many of the applications that we discussed in this presentation. The plunger head can travel back and forth up to 1 or even 1.5 centimeters, which is quite a bit. For those with plenty of muscle mass, there's a lot of benefit there. But for a lot of our patients, especially geriatric patients, it can be really painful if they have low muscle mass, and it's absolutely contraindicated for patients with low bone density. So if there's a chance that your patient has low bone density, or it's obvious that they don't have much tissue mass, then a percussive massager should be avoided. And that's why I'm much more in favor of having a vibrating massager in your clinic or gym, because it's just so much more versatile for therapy purposes. All right, selecting the appropriate tool. So there are numerous designs on the market that you can pick from. So there's a few things that I'll point out to watch out for. One is the number of heads of a device. A lot of them have 2 or more heads. I find that a single large head has the most versatility in a clinical setting. And the head diameter should be at least 1.5 inches, 3.8 to 4 centimeters at its widest part, to really have the most versatility. A larger head is just more adaptable. And the angle of the head, you often see back massagers that have a 90-degree angle on the head from the handle, enabling patients to reach their own back. A straight design can be more ergonomic for a clinician to use every day in the gym, but either design is certainly useful. When it comes to educating patients about what to get, if they already have something on hand, that's perfectly fine. You know, I always encourage using what you have over buying new. But if you're going to tell them what to buy, you know, you can make those judgment calls based on what their goals are. But most of the time, I just tell a patient to find what's available. A lot of my older patients are not going to be shopping on the internet, so these tools can be found at most pharmacies, especially the larger pharmacies. Walmart pharmacy doesn't always carry them in stock, but most of the standalone pharmacies do, or at least can order them pretty quickly. So I just tell a patient to get what they're able to at their local store. Power supply. So of course, nowadays, so many things are battery operated, including massagers. They do offer portability and convenience. They tend to be more expensive. So if you're getting pushback about buying one from whoever's in charge of purchases at your facility, a battery option may not be the best way to go. Corded designs are usually cheaper. You never have to worry about the battery dying mid-treatment. But really it depends on your preference and where you believe you're going to be using it in your setting. Modes. Some massagers only have one mode. A lot of them nowadays have 2 or more, such as like a high and a low mode, maybe a couple in between. Some have fancy modes that vibrate quick and then slow and alternate that sort of pattern. Those patterns I don't find to be helpful at all for most of the treatment issues that I'm using it for. I suppose they're beneficial for just relaxing muscles, but I prefer just a straight, continuous, unchanging frequency at each setting. And so looking for a model that has at least two modes, preferably one lower setting in the relax range, one higher setting in the contract range of the frequencies that we talked about before would be ideal. But again, you're gonna go with what's available to you. Most of the time when you're looking at these massagers like online or reading the box in a store, they don't often list the actual frequencies of each mode. It just says 4 modes or 10 modes or whatever the case. You know, they're trying to keep their marketing simple. So same with the description online, it often does not list the frequencies. Sometimes, usually not. Most of the time you have to purchase the item and then look at the user manual inside the box to actually find out what the frequencies are. A couple times I've been able to contact the manufacturer and find out, but you may just have to buy one or two, look at the frequencies in the box, and decide which one you want to keep and return the other. Watch out for the real cheap models for clinic use, because some of them, even though they may have 2 or even 3 modes, all of the modes are in the contract range, you know, up close to 100 or above, and that's not real versatile. The little bit more expensive models in the $50 to $60 range tend to be better about that. All right, so let me show you this. Power source, modes. All right, various models. So I will include links to these in the description. But the ones with the stars after them, the asterisks, are the ones that are my favorite. I think they're the most versatile. They also tend to be a little on the higher price range, but again, we're talking $100 to $200, and compared to other modalities, at least, that's quite cheap. I've worked in several different facilities in my career, and pretty much every single one of them was more than happy to buy one of these vibrating massagers because they're quite cheap. And once I explained the benefits, they were usually more than willing to get me one. So this is the most versatile form factor that I have found. One single large head, straight, not angled form factor, and nice large buttons, plastic, not soft material. You want it to be easy to clean so that it can remain sterile between patients, and corded design, corded power source. So this is my overall favorite design. Where to purchase? Online, most pharmacies. Also, your equipment catalog at your facility may also include them. So if your facility only likes to purchase out of a specific catalog, look through there because there may be one in there. All right, so read more. I initially wrote a blog post with pretty much all of this information in it, and I linked all the studies that I've found there as well. So this is the link to my blog post on vibration as a modality. I will also include the research linked in this video. Okay, let me adjust the view here. Okay, so now I will just briefly demonstrate how I use the massaging devices for treatment. All right, so first up, we have a sonic toothbrush. So this is a $5 model from Dollar General, and it's nothing fancy. It just has a sonic component to it. So you'll notice it's not the type of electric toothbrush that has a rotating or agitating head. It's a sonic vibration. So I find that it's easier to use the backside. The bristles are a little bit too soft when you're trying to get the vibration effect. So a patient can just apply it, directly to the affected area of the face, or the hand, the fingers, if that's your targeted area. Okay. Next, we have the massage ball. So this is just one I bought off Amazon. They're like $30. They have a power button and a charging port, and they're usually rubberized material, so they're pretty easy to sanitize with some wipes. And some of them have 3 or 4 different settings, high and low speeds. And so they're just going to hold it in the ball in their hand, and they can just kind of spin it around, move it around while they're holding it. Next, we have the typical back massager here. So this one, you're going to place the head on the treatment area. This is one that you're going to focus on treating the limbs with, not really appropriate for the face area. So let me get where you have a better view. Okay, so I may start treating the palm area like this. Then I may move up the arm, and we're primarily focusing on the muscle, thick muscle areas, muscle belly. Okay, I tend to avoid the tendon area. I find it most effective kind of in the center of the muscle belly for targeting muscles. All right, I'll mention one other device. This one is much more specialized and more expensive. It's called the Rapid Release Pro 3, I think is the model on this one. Rapid Release is the brand. So this one is absolutely fantastic. It's battery powered, but the biggest benefit, it has several different head designs you can see here for different areas. These are really popular with chiropractors, and also some outpatient clinics, because they're really good for reducing pain quickly. They do have an extremely high frequency of, I believe it's over 160 hertz. This is the highest frequency I've seen on any device on the market, much higher than any other cheaper model I've seen. As I said, you can achieve muscle relaxation with high and low frequency. Usually lower frequency tends to be more comfortable. This one is quite intense. It will achieve relaxation after treatment. So what it does is it creates a real strong contraction while the head is on the muscle, and that creates relaxation of the muscle after the massager is removed. So it can be quite intense, and if a patient has real severe pain, it's probably not appropriate. But you know, in an outpatient setting, their pain is probably moderately managed, and it can be really useful if you're looking to do some serious stretching. So the main benefit is that it's going to have a similar reaction or similar effect to other massagers, but in a third the time. So if a regular massager, some of those other models I listed there, they may achieve a result in 15 minutes that this can achieve in 5 minutes. So when you're strapped for time, you know, this can really be useful. The one drawback with it is that it costs $1,500. So it's really, really cool, but it also costs a lot more than most other massagers on the market. Okay, so that's my presentation about using vibration as a modality. I hope that you learned a few things. Feel free to reach out to me if you have any questions or you're interested in sharing any experiences with me. I'd love to hear from you about how vibration is impacting your patients.